If there's one thing that can ruin all the excitement after facial rejuvenation procedure, it's scarring. But there's something actually that's even more frustrating that can happen. If you want to learn what can go wrong after facelift surgery and how to avoid it, make sure you watch this video all the way to the end. I'm Dr. Amir Karam, board certified facial plastic surgeon. I'm also the founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. If you love learning about facial plastic surgery and how to keep your skin looking its absolute best, make sure you subscribe to this channel by hitting the bell. I upload a new video every single week with tips and tricks from real patients and my own experience. A lot of people are afraid of scarring after facial procedures, and they should be. It's a natural concern. But there's something even more concerning that's lesser known, and that is hematomas. Let's break them both down. Let's learn what they are, what causes them, and how to avoid them. First, what is scarring and what are hematomas? So let's start with scarring. Scarring is, by definition, the natural response to skin being cut, okay? So it's not necessarily the heavy negative connotation that you might be thinking of. It is just what happens when skin is repaired after an injury. Where does it happen? Essentially anywhere where you make an incision. In the case of a facelift, it could be along the hairline, behind the ears. In case of eyelid surgery, it goes into the eyelid creases. Lip lifts, it goes underneath the lip. Anywhere where the skin is cut is technically a scar. Now, why does it happen? Well, it's your skin's way of healing itself. When you make an incision, you create a breach in the skin. The skin is now weakened. Your skin stimulates the production of collagen, which helps bridge the gap and reinforce the skin to make it just as strong as the skin was before the injury. In addition, the entire process stimulates more blood supply, so you get blood flow going across the scar area, and the skin therefore becomes red, and during a period of time, it's going to be a little bit noticeable. Incisional scars go through a number of transitions. There's the initial injury, which is held together by sutures, and then there's a process of neovascularization, which means new blood vessels are forming to bridge the space between the incisions and bring all the nutrients and the building blocks it takes to build the skin into a strong structure again. And those building blocks, in this case, are collagen. And sometimes, in some cases, the scar can be a little bit more noticeable. The idea in plastic surgery is to make incisions as least noticeable as possible so the scarring becomes non-conspicuous and hidden very well. And we're going to talk a little bit about those types of measures that are taken to create the most unnoticeable scar. But in any case, skin is healed with a scar. Sometimes you can't see them, but just know that they're there. Now, hematomas, on the other hand, are basically bleeding that happens underneath the surface of the skin. At the time of surgery, measures are taken to control bleeding and stop bleeding. Surgery is done, the patient goes home, and at some point, they may bleed. And bleeding at that level ends up causing basically like a ballooning effect because the skin has been separated from the underlying structures. Now the blood is filling in this space, almost like a water balloon. Hematomas can happen anywhere where there is a potential space to bleed into. And it's more common to see this with facelifts than any other type of facial surgery. For example, eyelid surgery and lip lifts, they don't form hematomas the same way because there's not space to bleed into. Facelifts are notorious for this particular problem. The statistical rates generally go anywhere from 1% in females and up to 2% or greater in men. And we're going to talk about all the things that you can do to avoid them. What procedures can cause them and where? Anywhere you do skin undermining, so in the case of a facelift, they tend to be in front of the ear and into the neck. This is areas where the skin is elevated above the underlying tissues, because remember, in a facelift, you're separating the skin, lifting the fascia and the muscles so that you can get the lift on the tissues, and then you tailor the skin back down. With scarring, the traditional areas where facelifts are performed, scars run along the inside part of the hairline, along the edge of it. They go into the ear, behind the ear, and into the hairline. Each surgeon has a slight variation on how they perform. In my opinion, incisions at the hairline perform better because The last thing you want to do is, in addition to deal with a scar, is to change the shape of the hairline. Upper and lower blepharoplasty and other common procedures, the incisions ideally should be made at the natural eyelid crease. That's basically where the eyelid folds when the eyes are open. The lower eyelid has a little crease along the edge of the tarsal plate, which is basically where a segment of connective tissue maintains the shape of the eyelid, and it's 1 or 2 millimeters below the edge of the hairline. Those are typically where the incisions are made for lower blepharoplasties and skin pinch procedures. For the lip lift, the incisions are made at the base of the nose and taking a design that is shaped like a bullhorn. This again hugs the edges of the nostril along the lip nasal border in a natural groove, which heals very well if placed in the right position. Rhinoplasty surgeries, especially if they're open surgeries, the incision is made at the base of the columella, somewhere right in the middle of it. Again, every surgeon has a slight preference in terms of where they position it, but it's typically made across this area. The rest of the incisions are made on the inside. Hematomas are very uncommon in eyelid surgeries, lip lifts, and rhinoplasties. So let's start with scarring. Why do they happen in the first place? Or what might have gone wrong during surgery to cause them? So when it comes to scarring, let's talk about some things that can lead to poor scarring. So number one is poor surgical technique. And that is caused by putting too much tension on the edge of the incision. Now, when it comes to facelifts, for example, there are some techniques, and I'm strongly against this approach, but there's some techniques that use the skin to basically pull the face. You see this a lot with more traditional facelift approaches, etc. And in fact, the more tension you put across the skin edge, the more likely it is to lead to a widened scar, a hypertrophic scar, and an overall visible scar. At the end of the day, the goal is to have a very thin, hardly noticeable scar. The next is simply the patient's biological anatomy. Some people have a tendency to poor scarring. In fact, certain ethnicities, people with darker skin types, have been historically found to have a higher rate of hypertrophic and keloid scarring. Hypertrophic scars are where the scar is raised. It's kind of like a worm-like shape, typically in facelifts, most commonly behind the ear and along the posterior incision, the incision that's along the hairline. Thankfully, very, very uncommon to see it in front of the ears. But a widened scar where the tension is too great can lead to incisions in front of the ear. But the skin's biology can certainly lead to these type of events. And knowing that can really put the emphasis on trying to minimize skin tension, which can worsen and hasten anyone's natural biology. So even more emphasis on proper closure technique and certain measures postoperatively to decrease them. Another thing that leads to poor scarring is age. Younger people don't heal as well as older people. That has to do with the amount of collagen production that the body can produce. Younger people tend to have a greater amount of inflammatory process that leads to different complications with scarring, in addition to the fact that hypertrophic scarring can be more common. If you operate on somebody who's in their 60s or 70s, it's very, very unlikely that they're going to have complications related to scarring because their body doesn't produce the same level of collagen. So if you're a little bit older, this is actually a bonus when it comes to healing incisions. The third thing that leads to poor scarring is poor postoperative care. It's very, very important, number one, to minimize the amount of sun exposure to the skin during an entire year after surgery. A lot of people underestimate this. They get right back into the sun, exercising, etc. The incisions, if they get sun, they can either heal a little bit lighter or a little bit darker. Postoperative minimization of sun exposure is an absolute must after the surgery until that scar is really matured. Other aspects are if you see your patient, or in your case, if you see yourself starting to have some prolonged inflammation, redness that's going on, longer than say several weeks or even up to 2 months, and the redness persists, that could lead to post-inflammatory hyper or hypopigmentation. Good news about hyperpigmentation that it typically goes away. Hypopigmentation means that the scar will end up white and it won't go away. Sometimes this is out of anyone's control. It's again one of those biological factors. If you do find yourself in a tendency to have redness that is prolonged, that's a good time to maybe consider getting laser treatment to help reduce reduce the redness, or different types of measures and steroids and things like that to help reduce it. Additionally, postoperatively, if you find yourself having the beginnings of a raised scar, that's when you want to notify your surgeon right away and start the injection process of Kenalog or even 5-FU, which really mitigate the process of hypertrophic scar formation. Because what's happening in a hypertrophic scar is a overproliferation of collagen, and the combination of Kenalog and 5-FU minimize the production of collagen, therefore flattening that scar so it doesn't get raised. So making sure you stay in touch with your surgeon and bringing up any of these concerns right away so that your surgeon can do some proper postoperative care is key to good scar outcome. In addition to a number of things that you can do on your own to minimize the scar, which we'll talk about in a minute. So when it comes to hematomas, intraoperative proper hemostasis, which means controlling bleeding meticulously, is an absolute must for the surgeon. This is a surgical technique issue. If a surgeon is hasty in terms of controlling bleeding with cauterization or tying off small bleeders, that is when a hematoma can happen after surgery, because the patient goes home, those small little clots open up, and next thing you know, bleeding ensues. But there are health conditions that can exacerbate hematomas. Number one is high blood pressure. Probably the most important thing that can lead to a hematoma is if you have high blood pressure and it's not controlled after surgery. That can easily cause the heads of these small little capillaries and vessels to open back up after they've created a little clot, and bleeding ensues. So high blood pressure needs to be controlled either before surgery, ideally well into the perioperative and postoperative phases, or if you identify it after surgery, postoperative blood pressure control is an absolute must. We are very aggressive in our practice with blood pressure control. If we identify it at the time of surgery, we give them medications that they can take after surgery and control the blood pressure through IV medicine during surgery. So that reduces the high blood pressure spikes that can happen and leading to hematoma. So blood pressure management is huge. Another factor which is related to their health condition is some people have a natural tendency towards bleeding. This could be because they're missing certain blood factors that are responsible for clot formation. So the things that you want to be aware of. If you have a history of having surgery and you've had bleeding issues, make sure you bring that up to your surgeon. Number two, if you've never had surgery before, but you suspect it because every time you get a cut, it tends to bleed, and usually bleeding over 10 minutes is not normal. Or if you have a history of heavy menses or pregnancy that had issues with bleeding, any event that signals that there's a potential for bleeding problems, you want to make sure you bring that up, because in our practice, the minute we hear this type of history, we send patients off for blood work that checks for bleeding time, von Willebrand's factor, PT-PTT, and just look for the overall blood count to make sure that the person doesn't have a bleeding problem that has been undiagnosed, basically like an anemia. So these are all things that are responsible for bleeding after surgery. Another major risk, probably one of the most important and simple things that you can do to decrease the potential for having hematoma, is not to take things that are going to thin your blood. So for example, aspirin, Motrin, any of the NSAIDs, which are non-steroidal anti-inflammatory drugs, things like garlic, ginkgo, even turmeric is a big-time anticoagulant. In fact, I had a patient years ago who was taking turmeric shots before her surgery because of the anti-inflammatory effects of it, and during surgery, her blood was literally like thin like water. It didn't clot, and in fact, she ended up having a postoperative hematoma because she thought she was doing all the right things by taking these dietary supplements, and in fact, it caused her to have problems with bleeding. So in our practice, we literally have everyone off of every herbal medicine, every one of these things, and really, really control what goes into your body 2 weeks before surgery and 2 weeks afterwards, because the risk of hematoma exists for up to 2 weeks after surgery. So now let's talk about how to avoid them. So for both hematomas and scarring, the most obvious first thing you can do is choose a surgeon who is experienced at these type of surgeries. Experience goes a long way. The reality is, if you are doing these surgeries on a regular basis, in my practice, I do 6, sometimes 7 vertical restores a week, and I've been doing this for 20 years. I've learned how to close incisions well. I've learned how to avoid scarring issues. I've learned how to manage hematomas and prevent them from occurring. Great technique and proven results are key. That's a very, very important place to start. Number two, be aware of your own medical conditions and the risk factors that you bring to the table. Make sure you're communicating very clearly with your surgeon, letting them know if you have histories of blood pressure, hypertension, bleeding problems with other surgeries, any complications that have happened at other surgeries, and scarring related problems that you've had on different parts of your body. These are all very important things to share with your doctor. And number three, we are very, very meticulous in our practice in terms of telling people what they can and cannot do. Make sure you are following all the post-operative care instructions to the T. And a simple note, even with the most meticulous technique, the best approach, everything goes well, there's still a potential for both of these things to happen. But taking excellent care in the aftercare component is so important. And I'm gonna give you a couple really, really key examples. When it comes to hematoma, rest and relaxation for 2 weeks is absolutely must. One of the things that we do in our postoperative process is we use external compression sutures. When you close this potential space, there's literally no room for hematoma to expand into. Say your surgeon doesn't do these type of maneuvers, the quilting sutures and the compression sutures, etc. If you sense that there's a hematoma about to form, this is something you want to bring up to your surgeon right away. In the case of a hematoma, as soon as this area starts to fill, you want to basically let your surgeon know so they can bring you back into either the hospital or bring them back into the office, drain the hematoma either by opening everything back up and stopping the bleeding source, or if it's a small hematoma, drain the fluid and use compression sutures to close. But the bottom line is it needs to be brought up right away, because if a hematoma, especially if it's an arterial bleed, begins to expand too much, it puts pressure on the skin, diminishing the blood flow to the skin and causing a potential for skin sloughing and death to the skin, basically non-viable skin, because the blood flow gets shut off. That's when it becomes emergent. So you definitely want to make sure you don't sleep on this. It would be very difficult to sleep on a hematoma anyway because of its expanding nature. And make sure that your surgeon also doesn't sleep on this and addresses this right away, because if the hematoma is not addressed properly, that blood sitting under the tissues, even if it's a small one, can lead to contour irregularities and some healing related problems down the road. So vigilance and care in the postoperative case is very important. It has to be a team effort between you and your surgeon. Another thing that we do during surgery in all of our patients that are getting vertical restore is we give intravenous TXA. TXA is a drug that improves the clotting and decreases the risk of hematoma. It's an incredibly important part of the intraoperative management and hematoma prevention. So this is something you want to talk to your surgeons about, see if they're using TXA and if they'd be open to using it. In my opinion, it's a game changer. So between TXA, high blood pressure control, and postoperative quilting sutures, you can almost reduce the risk of hematoma down to zero. Maybe the most important tip when it comes to scarring. There are a number of topical things you can do for your skin to help decrease the potential for scarring. So for example, we mentioned sun protection to decrease the discoloration of the scar. In addition, you also may consider, especially if you have a tendency to hypertrophic scarring, to use topical silicone. We give this to all of our patients. Silicone is one of those potential topicals that actually has shown to improve scar outcome. Vitamin E has anecdotally been proven to show improvement in scars. In the early stages of the incision also needs to be sealed. Using ointment on the skin postoperatively is very, very important. The common things that are used for these are basically like Neosporin ointment, any of the petroleum-based ones like Vaseline or Aquaphor. In our practice, a lot of our patients use Enrich, which is a plant-based oil breathable balm, effectively creating a nice barrier for the incision, because what you want to do is basically keep the incision from drying out. Other things that can be used to improve the texture and outcome of the scar are things like retinols, which stimulate skin and cell turnover. Vitamin C is an anti-inflammatory. Niacinamide also creates an anti-inflammatory environment. as well as lipids and ceramides, which also can be calming for the skin. So I put all of those key actives into one simple system, the trifecta. The reason why the trifecta is so wonderful for post-operative use is because a lot of the retinols and vitamin C's can be a little bit too strong for post-operative incisions. The more gentle products like the trifecta can be more advantageous and less irritating to the incisions. So be careful if you're going to use retinols or vitamin C on the incisions as part of your normal anti-aging skincare routine post-operatively, because sometimes they can irritate the scars and make you move backwards. But so I'm cautious when I say use these things, but our patients with the use of trifecta tolerate it well because of the formulation of the retinol and the vitamin C. These things are all very important to do afterwards. So the sooner you can get the skin to decrease the inflammatory process, the more neutral the color of the incision will be after surgery. And for those of you who don't know what the trifecta is, it is a skincare routine and formulation that I developed several years ago that basically brings all of the actives that you need for anti-aging, all of them into a simple 3-step routine. So I put all of those key actives into one simple system, making it super easy. But if you're interested in anti-aging in general, definitely want to give this a try. I would strongly, strongly recommend it. Give it 3 months, you will be very happy that you found it. And for those of you who want to learn a little bit more about it, definitely check out KaramMDSkin.com. You'll learn what's in the trifecta, how to use it, and you'll see tons and tons of reviews and testimonials from people who are loving it. Over 12,000 people are currently using it on a daily basis. And if you want to learn more about proper aftercare and learn exactly what ingredients you should look for to reduce postoperative scarring, etc., make sure you subscribe and follow the KaramMD journal. I have it linked here in this particular journal that will talk about things related to management of scarring postoperatively. It's a free newsletter. You're going to absolutely love it. All right, so my final thoughts. Scars and hematomas are definitely a bummer when they happen. They're definitely things that you want to try to avoid, but they are not inevitable. If you follow the script here, you take good care of yourself before the procedure, your surgeon does the right things intraoperatively, you do the right things postoperatively, you can really minimize the likelihood of scarring and hematoma and ultimately get the best out of your facial rejuvenation procedures. If you do all these things, your risks are far less than 1%, and ultimately you'll get the benefits of the wonderful changes that can come from facial rejuvenation surgery. All right, thanks for watching. I hope you learned something here. I hope this was useful for you. If you found this helpful, make sure you check out some of our other videos in our library. This channel exists to help you feel more prepared and confident about facial rejuvenation and help you make the right decisions for your skin and anti-aging journey. And if you haven't already, make sure you subscribe to the channel. Until next time, Dr. Amir Karam.